Good evening, everybody. I thought I'd reply in person to the discussion that we had around lesson 2, the angina and the anatomy and physiology lecture. And what I'm reading from the feedback that I'm getting, thank you, Vicky, thank you, Claire, is what I'm hearing is a distinct note of confusion. Listen, I like confusion. I've got to tell you, I like the idea that students have their nice little cosy assumptions shaken, and that they've got to start going back to books and really making their mind up again, because it is useful. It's useful that people who are at degree level have their comfortable certainties shaken. You know, I mean, there are consensuses in life, but then there are always maverick points of view, and there are always people who take a different angle on subjects which everybody else thinks is all accepted. And the National Refractory Angina Clinic, which, can I say again, is an award-winning, a multiple award-winning unit. They take a very particular angle on all of this, and one of the features of their rehabilitation program is for them to use cognitive behavioural therapy in the treatment of angina pain, and that one of the aspects of that CBT approach is to think of your angina pain in a different way. Stop thinking of it as a ticking time bomb that any minute now is going to explode and you're going to die as the result of this pain, and start looking at it as this is your heart asking you politely for help, and in the meantime it's building up its own collateral circulation. That's a very different view, and I'm not saying whether I agree with it or disagree with it. What I'm saying is that it's fascinating. It's a fascinating view. And at degree level, my view is that we're beyond being student nurses now, where you're told you've got this a cause for disease, and that's it. We're in the adult world of degree students now, where let's pay attention. Let's be most interested in the bits that we are least certain about. One of the principles that I organise my teaching life around is this: I can respect faith in anybody, but it's doubt that gets you an education. And that's how I approach teaching. We are going to see in this module, we are going to see people on film who will argue that really fat in your diet makes no difference to a population as to whether or not they get heart disease. I'm not saying it's my view. What I am saying is interesting. Let's listen to the case. You know, let's see if it makes any sense. And let's come back to a more consensus view if that's how we're going to go in the end. So, very particular view, Dave, but boy, entertaining to listen to. And a real interesting bloke to sit there with a recorder and interview his point of view. But the Refractory Angina Clinic in Liverpool, award-winning, forward-thinking, whole radical new approaches to the treatment of angina. Shall we say that there was politics between them and the rest of the cardiological establishment on Merseyside? You know, politics. Anyway. The left atrial appendage, thank you, Claire. Yes, absolutely correct. An overflow chamber for the left atrium. Particularly useful in heart failure, where the heart is having difficulty in dealing with the amount of fluid that it's being presented with. In these circumstances, the left atrial appendage acts as a sort of reserve chamber and will expand to meet the pressure demands inside the failing heart. Inside the left atrial appendage, my understanding is that there are cells which produce more in the way of brain natriuretic peptide, which, as you've rightly pointed out in your replies, antagonise the effect of the sympathetic nervous system, sympathetic influences on cardiac functions. The heart is a gland. Yes, your heart secretes these peptides, these hormone-like substances, in order to soften the blow of sympathetic activity in heart failure. And what I'm interested in there is this: 2 points. 2 points. When people tell me that they don't think that student nurses these days have enough cardiac anatomy and physiology, I always ask them 2 questions. Well, sister, coronary care, what's the atrial appendage for? What sort of glandular function does the heart have? And no one ever knows. And it's basic. It's basic. I've only had one person ever in class answer me what the correctly what the annulus was. Nobody ever knows. All these so-called anatomists and physiologists. But there you are, rant over. The other thing that I want to draw your attention to when we're talking about the heart as a gland is that all body structures have 1, 2, 3. The same structure will have 1, 2, 3, 4 different functions. Mad functions, things that you wouldn't ever believe. You know, I mean, you ask someone what the lungs are for, and they'll tell you it's for gas exchange, which it is, of course, absolutely it is. But it's also a massive big capacitance vessel, isn't it? Your lungs is where angiotensin 1 gets converted into angiotensin 2. Angiotensin 2 is a vasoconstrictor and will drive up your blood pressure. Who'd have thought that your lungs would be so intimately involved in the maintenance of blood pressure? I wonder if you've all looked at the cardiac dissection that I filmed there. That was me in class with a pig's heart. There is nothing, believe me, nothing like seeing a pig's heart from the inside to understand the complexities of the internal structures of a pig's heart, which, to all intents and purposes, it very much resembles a human heart. Running short of time now. Silent MIs. Well, silent MIs tend to occur in people who are diabetic or who are old. This is because the already tenuous nerve supply of pain message to the brain is further compromised by the neuropathy that diabetes and age brings on. As for lesions, extensive lesions in heart that you demonstrate on angios, well, the relationship of what I'm going to tell you, the relationship of pain to the degree of narrowing of an artery isn't always 100%. It's not always the case that a person with extensive narrowing is going to have. Although I've got to wonder, if they're not getting pain, why did they come and have the angio in the first place? So, nice to see you replying. Keep it up. Very impressed by the quality of the replies so far. Keep it up, and I'll make another, unless I have to make one in the meantime, I'll make another little film next week. So, good evening, everyone. Mind how you go.